Hi, I'm Stephanie, and in this video, I want to share with you some advice and help you if your doctor, nurse, or midwife is unsupportive of natural birth. Now, unfortunately, this is something that does sometimes occur, and there are a couple of different ways that I see this happening. So, the first situation is what I personally encountered with my first natural birth, where my doctor wasn't necessarily unsupportive, he just wasn't very encouraging. So, I remember he would say things like, sure, you can attempt it, and many women do, but, I just want to let you know most end up needing an epidural or help from us. But then I also remember he would say things like, well, you're probably a good candidate for natural birth because you are tall and you're pretty young, as if only tall young women can have babies without any outside help. And I remember after he said that, I was wondering, well, what did our ancestors do if they were short and got pregnant in their late 30s? But apparently, to him, he thought that height and age were major factors for natural birth, which I don't necessarily agree with. And just a side note here, if you want to know what is important, I encourage you to subscribe to my YouTube channel where I have a whole series of videos that show you how to have a natural birth. Just click the link at the bottom of your screen if you're on a desktop or on the top right of your screen if you're on a mobile device. So if your doctor reacts similarly to how mine did, you pretty much can assume that he or she is not going to help you through the process of natural birth. And this isn't necessarily a bad situation because it forces you to prepare and take control. And the typical OBGYN is familiar with medically based births that are filled with medical interventions. And they are definitely someone you want in your corner if an emergency comes up. But the reality is that they're not a natural birth coach. And I personally always approached both of my natural births as if I was on my own. And so I had to prepare and feel confident beforehand. Now, I should say my husband was extremely supportive and we made a great team. And any outside help I received from the hospital, I just looked at it as if it was a bonus. And the second common scenario is you may have a birth provider that makes your decisions for you and doesn't give you a whole lot of options. So you may hear them say things like, so this is what we're going to do, or maybe you're talking about something with them and their instant response is, yeah, that's not a good option. And sometimes this happens late in the third trimester when you're ready to go over your birth plan with them, and maybe they won't allow certain parts of it or are not open to certain things. So for example, maybe they won't let you have a water birth or change positions during labor or allow you to do instant skin-on-skin contact or delayed cord clamping after birth. Or maybe you're a couple days past your due date and they won't let you go much further, so they schedule your induction without asking or discussing it with you. Or I know, for example, my husband, who's a prenatal chiropractor, commonly sees women in his office who are around 37 weeks with a breech baby, and they're trying alternative methods to allow their baby to turn head down, like obviously chiropractic care or maybe spinning babies in various stretches, but they run out of time because their doctor schedules a C-section around 38 or 39 weeks. So basically, they're not allowing you to follow your birth plan or explore different options that are alternatives to medical interventions. Now, to state the obvious, you first have to make sure that you and your baby are healthy. So every medical intervention was originally designed to help keep mom and baby healthy. But what I'm talking about here are situations where you're not at risk and still not allowed to follow a natural birth plan. Now, first off, when you're trying to have a natural birth, you have to know what you're in for. If you're going to have a natural hospital birth with an OBGYN, you're already going against the grain by not doing certain medical procedures, many of which are routine and followed by most women. And you have to be prepared to ask questions and express your feelings on a regular basis. And this can become exhausting and sometimes stressful because let's face it, you're speaking to someone who's an expert in their field, and in so many words, you're basically saying like, hey, I have a better method, or maybe I shouldn't say better, but an alternative method that I would like to try instead of what you're recommending. And the thing about this is that sometimes you're making their job harder. Like, let's say you want to deliver in an assisted squatting position, and they have to get down on the ground. Or if you don't schedule the C-section for the breech position and then you do end up going into labor, they have to scramble to perform an emergency C-section. So disagreeing with your birth provider will probably become common, but it's just kind of how it goes. But at the end of the day, you have to do what's best for you and your family. And I find that if you are immersed in natural birth and prepared to have conversations based on research, the conversations usually go smoother. So come prepared to have a respectful and healthy conversation with your provider based on your research. And my second recommendation is that you should also approach pregnancy and labor as if your doctor is part of your team, and they should be doing what's best for you. So I always say, think of it like a professional athlete or, a famous celebrity who has an agent that helps them through their career. A great agent will respect their wishes and help them reach their goals. And at the end of the day, the agent works for the client just as you are the client, patient, and customer. Now you can change providers if you need to, and it's not as hard as you would think. I actually did this with my second pregnancy when my birth center shut down during my third trimester and I was left without a birth provider. Yes, it was a stressful situation, but I guess I always approach pregnancy and labor as if I was the one in control and I just needed a birth provider to answer questions and step in for emergencies. And you can have the absolute best doctor, but you're still the one that's going to have to manage labor, just as the professional athlete can have a great agent or coach, but they're still the ones that are going to have to perform on game day. So I always looked at it like, of course I want someone who's supportive and good at handling emergencies or able to perform a C-section if I needed one, but I'm the one managing my pain, controlling my mindset, and they're just there for emergencies. I was always in control of my outcome. Now, if changing providers is just not an option, you can always labor at home as long as possible, which I recommend regardless, and that way you're able to do all the things that you want. So just try to spend as much time as you can outside of the hospital. Now, you just want to be sure that you have a birthing partner keeping an eye on any changes in your mood and timing your contractions. And if you live further away from your birthing location, you can always try to get a hotel room if possible to labor in, just to be closer to that location. And many times OB/GYN offices have multiple doctors, and there's a very good chance that your doctor won't even be your delivering doctor. Now, if you're watching this and thinking that you could use a little help preparing and taking control of your pregnancy, as I mentioned earlier, be sure to follow and subscribe to my YouTube channel to get a lot of free tips and advice on natural birth. Or be sure to check out my e-course, The Mason Method for Natural Childbirth, where my husband and I cover everything you would ever need to know about natural birth. It's a done-for-you, step-by-step course that can be done in just over a weekend if you need to, and will help take away any confusion you may have and will provide you with clarity and give you complete confidence on achieving the birth of your dreams.